A 60 80 years old woman, previously rheumatic fever, is admitted with pyrexia of unknown origin. Her blood culture are unhelpful, but transesophageal echocardiography reveals vegetation on the mitral valve. Infection of with which of the following organism is most likely? So it is very obvious that a 68 years old woman and suffered from rheumatic fever. That means the heart valve of the women was damaged previously, but now develop pyrexia, that means fever, but their blood culture unhelpful, that means blood culture normal. And transesophageal echocardiography, it reveals there is a vegetation of the mitral valve. That means there is previously damaged mitral valve, again there is the infection. Which organism is responsible? Here the options are Staphylococcus aureus, Streptococcus pyogenes, Streptococcus viridans, Staphylococcus epidermidis, and Staphylococcus saprophyticus. So which may be the answer? First of all, let's see the Streptococcus pyogenes. So the Streptococcus pyogenes, it is a coccus. It is coccus, and it is gram-positive coccus, and it usually forms chain-like colonies. So Strep pyogenes, it is gram-positive cocci, and it forms chain-like colonies, and it is group A Streptococci. So Streptococcus pyogenes, it is a group A Streptococci. It produces beta hemolysis on the blood agar media or blood agar plate, and it is a really normal microflora, normal skin microflora. So it is normally in the skin, the Strep pyogenes is absent, and it also catalase negative. Now let's see the Streptococcus pyogenes. It acts by which pathway? It's a virulence factor by the two important enzyme. One is the hyaluronidase and another one is streptokinase, and this hyaluronidase and streptokinase, they are the damaging effect in the different part of the body. And also it releases the super antigen at the pyogenic exotoxin A, which result the scarlet fever. So the Streptococcus pyogenes, it one of the important action is the scarlet fever, and it remains sensitive to penicillin, also the macrolides. Now see the viridans streptococcus or Streptococci viridans. Here the point is very important, that it causes infection in previously damaged heart valve. So this point is very important, that in previously damaged heart valve, the organism is responsible for viridans streptococci, but the responsible for damage of the heart valve by Streptococcus pyogenes. This point is very important. That means in the acute form, it is by the Streptococcus pyogenes, and it causes the damage of the mitral heart valve. On the other hand, when the valve damage established, in this condition, if infection occurs in the mitral valve, it is the viridans streptococci. So I think it is very clear that our answer is the Streptococcus viridans. Why not Streptococcus pyogenes? Because the Streptococcus pyogenes, it causes acute infection. It causes acute infection of the mitral heart valve, and it causes the structural damage. But after a longer period of time, that means the rheumatic fever present the few years ago, a longer time back, but when now newly infected this heart valve, and this type the organism is the Streptococcus viridans. This type not the Streptococcus pyogenes. So I think it should be keep in mind that in case of the acute form, Streptococcus pyogenes, but when the vegetation established, that means the heart valve damage established, then again infection on the damaged heart valve, in this condition the answer is the Streptococcus viridans.